It's July 2005 and the sun is setting on a unique era of healthcare in the remote Somali districts of Elder and Haradere. CHISP, the Italian NGO that has been the only external supporter of the poor nomadic communities in this vast ocean of sand 300 kilometers north of Mogadishu, is experiencing funding uncertainties after a presence of more than 12 years. But rather than fearing for the future of the health services that CHISP helped them to build, the 70,000 residents of these two districts are facing the future with unswerving confidence. Unlike other communities in their position, they know their health services have been built to last.
intii aan cisbitaalka aan arintiisa la gaarin oon aasaaskiisa la jeexin oon dhaqaatiirtu imaanin annagu waa il darayn oo aradii mid uur leh oon arinteedu ahayn ilaahow fududeeyay oo xooga ay ku adkaato in ilma galeen ku dilaaco iyo in ubadkeedu saqiiro iyo in ayadoo dhan la aaso dhaqaatiir sharaf laho dhiiga kugu shube haddii aad dhaawactahay boogta ka dhaye naagtii dhali wehaysa dhinaha ay ka qalahayaan ayaadan dhib dareemin caanuhu geediyoon ka dhiman ayaa inta loo dhaqdhaqo daawo lagu dhibciyo oo dheerab lagu lahaababa naaska loo dhigaa.
In many respects, Elder and Haradere are typical of hundreds of pastoralist communities across Africa. Geographically isolated, they should qualify for support from dozens of willing donors. But in the 14 years since the end of Somalia's civil war, CHISP has been the only agency to have launched a major development project here. Perhaps because of the lack of donors and the dependency that inevitably accompanies them, this health project has become one of the most self-sufficient in the whole of the Horn of Africa.
To me, the fact that a community has been able to pay the salaries of the staff that is providing the services, that have been able to solve issues together, that have been able to maintain that and to give to the health professionals, the doctors, the nurses, the people that are working in those projects, enough confidence on their involvement for them to choose to remain in a rural area rather than going to urban areas where they will have other opportunities of employment, or even to move to other agencies that can give them maybe better salaries. And so that's what makes me think that there is something genuine and there is something that we should learn from that experience.
Today, in the desert oasis of Elder, 300 kilometers from the nearest large town, herdsmen who have never seen a concrete building can access every type of medical care, from vaccinations and tuberculosis treatment to cesarean sections and other major surgical operations. Elder District Hospital is a model of efficient modern healthcare with a dedicated team of highly trained medics, a full array of in- and outpatient facilities, an efficient cost recovery system, and strong professional management from the local district health board. Of course, it was not always this way, as District Medical Officer Dr. Talil Abdi Afrar recalls.
Most of the health service programs was being planned in the Ministry of Health, and most of the decisions and the implementation, even activities, the beneficiaries and the communities, they were not involved. It means that they were just getting service, but they don't know where the service was coming. And even there was not a single statement and single decisions that they were involved with during the planning or even maybe the implementation.
What makes these communities different from so many others that have become dependent upon donors and well-wishers is their unique self-reliance. A reliance born of hardship and cemented by the realization that no external support ever lasts forever. When the project faced an initial gap in its funding from the European Commission in late 1999, the newly restructured health board reached out to local businessmen and members of the diaspora and managed to fill the gap themselves. They also put in place a system of nominal healthcare charges, which, like so many social services in Somalia, leans heavily on principles of compassion.
Well, it is very much affordable because it was developed by the members of the community themselves. So they base it on the availability of resources in the community. It made sure that nobody is denied of curative care, because anyone who can't afford to pay a single cent was always paid for by the either the health staff belonging to the same clan, or by a member of the community or member of the district health board who comes from the same clan.
After surviving the fast funding gap, the community's contribution to the health services has continued to climb, from $37,000 in 1999 to $75,000 in 2002 to an impressive $157,000 by the end of 2004. Today, health fees and donations together account for over 40% of the operational cost of the services, which also benefit from a steady influx of local volunteers. As well as developing a second 5-year strategic plan to guide the planning and financing of the health services, the communities have initiated a continuous program of managerial and technical training for their staff, helping them nurture some of the highest caliber medics in the country and leading to a host of unexpected benefits.
When they were given the total amount of money that they needed to plan for in the next 2 years, they did tone down their requirements, even went to an extent where they saw the need to fit their plans to the budget. And they even did something that normally doesn't happen in Somalia. They retrenched staff, and they did so without any problems because it was a community decision.
Although the project staff attribute the success of the project to the resilience and commitment of the communities themselves, there is no doubt that CHISP's own resilience and a length of service probably unprecedented in present-day Somalia has helped to build a vital trust and transparency between the two partners. Today, that trust extends from the lowliest herdsman right up to the district commissioner.
CISB si hagar la'aana ay deegaanka waxay ugu raadinayaan projectada ama waxbay soo liflifay annaguna wixii ay soo gaarsiido tan soo gudbada waxay leedahay barnaamijka leedin soo anfixi intaan waaye projectada dhaqaalaha leedin ku talagalay intaan waaye annagana waxaan leenahay marka saas waaye sida loogu talagalay ha loo socodsiyo marka annagoo ku qanacsan wax ay keentay qaababka iyo madaxyada ay kala galayso oo marba hadii is aamin yimaado ibn aadanka wax ugu dambeeyay la isla gaaro waa taasa waxay keentay marka hay'adan inay joogto ilaa 12 sano 13 sano ay keento haddaan is aamin jiri lahayna ma wada shaqeynaa marka is aaminka keenay joogitaanka iyo wax qabadka.
Of course, the most important statistics when assessing the successes of a health project are those of society's general well-being. Although still new, some definite trends are emerging in Elder and Haradere that indicate a steady decrease in deaths from malaria and tuberculosis, together with a steady increase in hospital use, despite the fact that this now carries a significant charge. What is completely clear is that the presence of a reliable health service has brought these people a new confidence in their ability to survive one of the toughest natural environments on Earth.